Dear viewers, I hope you are all fine. This ultrasound video shows twin pregnancy with both blighted ova, also called an embryonic pregnancy. You can see the uterus having two gestational sacs and both are empty. No embryo or fetal pole is visible in their interior. A blighted ovum eventually results in miscarriage. Some women choose to wait for the miscarriage to happen naturally, while others take medications to trigger the miscarriage. In some cases, a procedure called dilatation and curettage (D&C) is used to remove the placental tissues or the gestation sacs. What is blighted ovum? A blighted ovum is a pregnancy where a sac and placenta grows but a baby doesn't. It is also called an embryonic pregnancy as there is no embryo developing baby. Because a blighted ovum still makes hemorrhage, it can show up as a positive pregnancy test. Now you can see the intertwined membrane seen in between the two gestation sacs. So the blighted ovum is a type of miscarriage that occurs very early in the pregnancy, in which the fertilized egg is not able to develop into an embryo after it has attached itself to the uterine wall. Often it occurs so early that the woman doesn't even know that she is pregnant. If blighted ovum causes about 1 out of 2 miscarriages in the first trimester of pregnancy. A miscarriage is when a pregnancy ends on its own within the first 20 weeks. Many women complete the blighted ovum miscarriage naturally without medical intervention. If a woman has already started bleeding but it is stable, a doctor may offer to do a D&C, dilatation and curettage, to clear the uterine lining of tissue. She might also take medications to help pass the products of conception at home. Blighted ovum bleeding will be something like a period and last for about a week. A blighted ovum feels similar to the normal pregnancy at first. That is because the baby's senses something has implanted, the body senses something has implanted into the uterus and continues to produce hormones including HCC that causes early pregnancy symptoms. It's a cellular or chromosomal failure. Second, the ovum is not solely to blame. It is egg and sperm that do not speak to each other. And third, a silent miscarriage also refers to an embryo with no heartbeat. A blighted ovum eventually results into miscarriage. Even though the products of conception are still may be contained in the uterus, if this happens, so the patient may be given the choice of letting natural take nature to its natural course or having a procedure called D&C. So there are signs of failed pregnancy. Early on, you may also have some common pregnancy symptoms such as fatigue, nausea, and sore breasts. Later, when the hemorrhage hormone levels begins to go down, these symptoms will subside and you are likely to have spotting or bleeding. At first, you might notice some reddish brown staining. A woman early in her pregnancy may have a miscarriage and only experience bleeding and cramping for a few hours, but another woman may have miscarriage bleeding for up to a week. The bleeding can be heavy with dots, but it slowly tapers off over days before stopping, usually within 2 weeks. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.